Everybody, BK with Masada Tactical here with another video. Kind of continuing the trend of stuff we started discussing already as it pertains to civilians carry firearms. We started covering some tactics, some skills, and one topic that keeps coming up as I'm teaching all these wear and carry or CCW classes, depending on the jurisdiction you're in, what they call them. One topic that keeps coming up is the idea of trauma care. I'm obviously a medic, and that is something that's very close to my heart and I feel is super important. But there's got to be that understanding that if I am carrying a firearm, it is because I am taking the assumption that I may have to use that firearm. If I use that firearm, deadly force event, that means that either I shot somebody might have shot me, one of my loved ones around me may have gotten hurt, right? That is the context in which we carry this firearm, this tool to begin with. And it would be, I would say, irresponsible of me to carry this tool without carrying additional tools to treat those injuries. Obviously, I care mostly about myself and my loved ones, with that assailant being further down the totem pole. Ethically, being a medic myself, I probably would treat that individual, assuming he has those survivable wounds, but further down after I treat myself and those I care about first. So the question always comes, what should I carry? How should I carry? How realistic is it to carry stuff? Because really, let's be honest, we get lazy, we get complacent. We don't want to carry a lot of gears on us, right? Because in theory, you should be carrying extra magazines, should be carrying a flashlight, source of illumination. You know, there's all these tools that come with me carrying a pistol. Where do we draw the line? And really, when it comes to, first of all, to how to carry and should you carry, I'm a big proponent of ankle first aid kit. So this one is made by Riker Nylon Gear. I'm a big fan. This is a new one, just took it out of the bag, but I usually have one on me and it's been pretty worn out. I'll be honest, super comfortable. I hiked up Masada, so think about 1,300 feet of elevation in about 2 miles. With this on my ankle, didn't feel it. I go camping with it. I wear it when I teach at the range for hours at a time. This is really a comfortable way of carrying the tools that you're gonna carry. The tools you're gonna carry have to match what you're intending on actually meeting and dealing with, and your level of knowledge in actually treating those wounds. So if you haven't already, highly recommend that you take some kind of trauma class. Obviously, being biased, you should come to ours, but any trauma class is gonna be good. Learn how to apply tourniquets, how to use chest seals, how to use nasal pharyngeal, the nose trumpet, right? Learn how to address certain wounds that you're likely to encounter. So again, just going over what's on my table, let's dissect it and see what of that is actually applicable to you or to us as concealed carry pistol carriers, or is it something that we really should just discard and put aside? So the military, being in war for over 20 years, the US military has come up with a lot of good statistics and something we should certainly take to heart. And one of the main things that came up is what they call the 3 survivable, right, injuries. So potentially survivable, meaning those are those injuries that we lost service members to, but we probably could have saved them. So the first one would be extremity hemorrhage, okay? So bleeding from arms and legs, and that I usually will address with a tourniquet. This one is the CAT tourniquet made by North American Rescue. It is arguably the most popular one out there. It is one that gets issued to a lot of our service members, gets issued to a lot of police departments. Certainly something you can buy online, either on North American Rescue website or other sites. I will caution on all these tools. If you buy something from online retailers such as Amazon or something similar, just be wary that what you're getting is an authentic one and not an imitation, cheaply made replica. The one time that you may have to use this is not the time where you want to find out, I should have spent a couple more bucks to get the real thing rather than something that's not working, because at that point it would be too late. So a tourniquet would address my extremity hemorrhage. Again, according to the military, 60% of my survivable wounds are extremity hemorrhage. Another 30% are penetrating chest trauma, specifically those that lead to what's called tension pneumothorax. I'm not gonna make this into a medical class, but ultimately, if there's a hole in my chest where one shouldn't be, I want to occlude it. I want to seal it. So having an occlusive Chest seal is going to be key. This is a pack of 2. These are called hyphen. I highly recommend having 2, not just 1. I hate when I see someone saying, well, I carry and I only have 1. The reality is, again, if we thinking of the context of gunshot wounds, okay, then there may be an entry wound and there may be an exit wound. And sealing one hole, if I didn't seal the one on the other side, kind of defeats the purpose. So carry 2, all right? So those are 30% of those preventable causes of death. And then the remaining 10% are typically associated with airway obstruction. This is where the nasal pharyngeal is gonna come in. I prefer nasal over oral one. Because I am avoiding the potential gag reflex that some people may have. And honestly, these are made out of silicone or rubber, and the oral ones are typically rigid plastic, which means I have to carry a bunch of different sizes, where on the nasal one, I can carry one larger one, and I could trim it with a pair of shears if I had to fit a smaller person. So I can make it work. It's not ideal, but certainly something that I can work around. So I prefer the nasal one. Other things that I have on my table right now, I have a compression, what's called an Israeli bandage, to deal with bleed that do not require necessarily a tourniquet, but I do want to apply direct pressure. This is a good tool. I'm gonna make a separate video on this one, just because there's some features that most people either are not aware or haven't been training with, so I wanna make sure that everybody is good with that. And combat gauze made by QuickClot. This one has an hemostatic agent in it, so as I put that gauze to pack a wound, that hemostatic agent starts the clotting mechanism. So these are certainly important ones, but if I have to start trimming down on space, these are the 2 that I probably put to the side and maybe put them in a larger pack that is not on me personally. Understand what I'm carrying on me for the most part is to be used for me, right? So my tourniquet is for me. I will carry a second tourniquet for somebody else, and I will have a bigger kit in a staging area, in my vehicle, at my house, right? Where I would have more tourniquets for more people. There are deficiencies in the CAT, okay? So this doesn't fit all size limbs. There's a plastic plate here that really limits the circumference of the limb I can put it on, right? So if you're dealing with pediatric patients, if you have kids, or if you have pets, canines, dogs, right? This will not work, and you'll need a separate or different type of tourniquet. So again, considerations that I should have, and I will discuss those again in a future video. I mentioned shears, and I want to make sure that I stress this is important, specifically if we're talking gunshot wounds. Gunshot wounds have a tendency of not necessarily appearing or manifesting themselves in the way Hollywood depicts it. And I want to find those wounds. If I finish a gunfight and I'm going to address somebody and I want to look for those wounds, I need to really make sure that I do a proper trauma assessment, and I'm going to need those shears in order to cut close and get in there and actually look for those bleedings as they present themselves. If I'm just going to go by the obvious wounds, I may miss some that are a lot more important and a lot more urgent for me to deal with. Really what I want to discuss real quickly in this video is prioritizing. So tourniquets became kind of like the hip thing for everybody to carry because, again, knowledge learned from the military, and it's certainly a good tool and something that you should have on you. But if we concentrating on gunshot wounds and we think of us going to the range, for example, right, where do we shoot at for the most part? And I would argue that most of us are trained to shoot center mass, right? Some get trained to shoot head as well, or pelvic, depending on the training that you follow, but certainly center mass, right? A tourniquet is not gonna help me on center mass, won't help on head or pelvic either, but center mass. Now the military is less concerned about it, right? Remember, they only get 30% of injuries as penetrating chest trauma because they typically wear body armor. Civilians, I know I don't, I wish I did sometimes. I don't walk around with body armor on me. So if I'm gonna get injured in the chest, a chest seal arguably is a more important tool than a tourniquet. Again, with the expectation of a penetrating trauma. If my main concern is falling because I'll work on cutting trees or vehicle car accidents because I'm not worried about gunshot wounds, then tourniquet may be more important, right? Or other tools, right? Splints and so forth. But if I am concerned about gunshot wounds as a concealed carry permit holder, right? I certainly want to make sure that I have some of this on me. All this is, honestly, is a piece of nylon. I'm gonna open one up so you guys can see. There will be 2 of them. It will come with a little wipe to wipe blood or whatnot from where you're gonna put it. If you guys can see, there are 3 channels. This is called a vented chest seal, which means it will allow pressure to go out, but prevent pressure of increasing by air coming back in. The way this works, it's really sticky, okay? This is really sticky. That's the idea. I wanna put it over the wound and to make sure that I'm essentially replacing what skin would do, right? I am sealing that hole. In the absence of having true chest seals, anything that you can put on the chest to seal that hole would work. AEDs became pretty prevalent over the past couple of decades. Every public place has them. AED pads would fill that role. If you don't have AED pads, any piece of plastic, a plastic bag or so forth would do the trick. Duct tape is phenomenal. I know a lot of people that don't want to carry something this bulky, but would have a little roll of duct tape with them, and that can be used as a chest seal if I needed to. It won't be vented, it won't have those channels, it won't be as good, but in the heat of the moment, it will work. Again, remember that unlike the military, we are never too far away from a definitive care, right? We're in an urban environment, hospitals all around with ERs, trauma centers, and so forth. So certainly education and knowing where those are matters, but understand that when I call 911, the ambulance eventually gets there, I am never hours away from care. I may be minutes away from care. That duct tape will do the trick. It's not my first choice, but it's certainly a good backup plan if you need one, all right? So as we go through some future videos, I'm gonna start dissecting each one of these tools, proper application, how to use it, and we're gonna do drills. I'm gonna show you drills on how to do this in conjunction with my firearms training, right? I should always put the 2 together. Going and just learning how to shoot without learning the trauma care is only addressing half the problem. Make sure you follow us on social media, right? I forgot to mention that. So social media, Instagram, YouTube, obviously, Facebook, @Masada Tactical, and all of those. And give us a like. Till next time.